state for a total of 2,538 to date. We will continue to come before the community and update you multiple times a week until we're on the other side of this. We will continue to treat the media and residents as partners and as critical members of a team. We will continue to share accurate information with you that you need to hear, whether the news is positive or challenging. We will attempt to be as transparent as possible and as we are able as we go forward. We will continue to ask you to stay calm, stay home, and adhere to social distancing, and of course, stay connected to friends and family. Citizen buy-in to current and any potential future restrictions will save lives, flatten the curve, and lessen the negative economic impact that we're facing currently as a country. Let's talk quickly about the Emergency Operations Center. In partnership with the Winnebago County Health Department and dozens of local agencies, the EOC continues to focus on the following: monitoring the outbreak of respiratory illness caused by COVID-19, hospital coordination to address possible patient surge and equipment shortages, develop, create, and implement a revised initial first responder plan to promote sheltering in place and reducing patient surge to local hospitals. Provide public education regarding personal hygiene, seeking medical attention, and personal isolation. Support hospitals and healthcare providers with testing procedures. Support law enforcement agencies as they develop methods for possible restrictions regarding public movement. Staff inventory and manage the Resource Supply Center, which opened officially yesterday. Identify critical infrastructure, essential services, and resources. Begin to evaluate the need for alternative care sites. Develop, create, and implement a donations and volunteer group and a policy for donations management. The hospitals are literally transforming their operations to assure we are as prepared as possible. A good example is in the media today. We've seen it on social media. Swedish American Hospital hosted a COVID-19 drill in the event of a surge. Multiple hospitals have bluntly and candidly shared their thoughts with the local media this week about their preparation efforts. We want to thank them for their leadership and partnership. The lives of our residents have been temporarily disrupted in ways we couldn't have imagined just a few months ago. For that, I just want to say thank you, and I want to challenge you to stay committed to this important effort. Very few of us are doctors and nurses and first responders. But at this time, those of us who are not doctors and nurses and first responders have the opportunity, through our behavior, to save lives by staying home and adhering to social distancing. Or, conversely, we could actually endanger lives by not taking what we need to do seriously. I heard the Chicago mayor today say that she's going to bring in celebrities in the Chicago area to help with an information campaign around these basic principles that we've been talking about here in Winnebago County and the Rockford region for a few weeks now. If you need a celebrity to tell you what to do at this point around social distancing and staying put, then you're clearly not taking this as seriously as you should. I want to re-hit an important point with young people. Of course, you are not immune. Unfortunately, we've seen folks that range in age from teenagers into their 70s who have contracted COVID-19. Dr. Martell and Mayor McNamara have both made the point that you cannot have any symptoms but actually be spreading this if you do in fact have it and you haven't developed symptoms yet. That is another and a very important reason why we need people to stay put, continue to wash their hands. Let's talk quickly about the economic impact to our residents. Not every resident in Winnebago County, not every business has been impacted equally. That, of course, is not fair. While some citizens have had their lives disrupted by having to stay home and work from home, others have lost their job and find themselves filing for unemployment. It's not fair, and we are going to work as hard as we can on the economic development side at the federal and state and local level as you are seeing public health officials work on the health side. You've seen Congress talk this week about a $2 trillion stimulus package. There's a variety of actions going on around business at the state level. And I want to personally thank Mayor McNamara, local banker Jeff Holtman, and John Phelps from the RLDC for their leadership in an emergency small business project that was announced at City Hall yesterday. Mayor, thank you very much for your leadership on that. I have been asked several times as chairman and as a Republican to respond to recent comments by President Trump around an Easter time opening of business. And I want to talk very directly about that because people listen to local officials at different levels. Although I admire his optimism, I do not think we're at, when you look at the facts, when you listen to the experts, that we're at a point where an arbitrary date is what we should set our sights on. We need to, as our best economic development policy, focus on stopping the spread of COVID-19. I cannot be any more clear about that. I think that timeline of that is going to dictate when all business is open throughout the country and in our state, far more than a particular date at this time. Lastly, I just want to go back to something that we talk every press briefing about, is this idea that just because we have a pandemic, we do not want to have an infodemic. I want to thank our media partners for continuing to push out accurate information. Again, you should be getting your health information from the Winnebago County Health Department, from IDPH at the state level, and the CDC at the national level. I want to thank Dr. Martell for her leadership on this topic. And with that, I'm going to turn things over to Dr. Martell, but continue to stay home and adhere to social distancing. Thank you.
Thank you, Chairman Haney. As the chairman outlined, and as we've said every press briefing, we continue to monitor the situation, and we continue to prepare throughout this monitoring. We need to identify the critical resources. We've been talking about personal protective equipment, or PPE, hospital beds, ventilators, and also our human resources, which are the doctors and nurses, all in the support staff that are required to care for individuals who are sick. While our current resources are adequate, we're continuing to work together to address those gaps. And so when you hear about what's going on in the Emergency Operations Center, they're beginning to pull in all those various resources and supports that we need to help us address those gaps. We have based our modeling on trusted epidemiologic methods. Admittedly, there is not a magic, I'm going to say, formula that tells us exactly how this will all look and what this may mean, but we are trying to go with expert advice in our region and through the state so that we can help better model and understand how this might impact our region. We currently have a doubling every 6 to 7 days. Our current number of cases is 8. We have not increased from our last report, but 59% of our results are currently pending. So we know that we still have some information out there. We've been looking at the number of potential hospital beds, a number of ICU beds, what's currently available in both hospitals and ICUs. And why is that important? Because one, we know that the hospitals are beginning to transition and transform, as Chairman indicated. So the available hospital beds today may be transformed into ICU beds as we move out patients who are no longer need to be hospitalized. We are working with other care partners, such as our large federally qualified health centers and our other health systems, to begin to take a look at how they might support triage efforts as well as testing efforts so that we can only have critical individuals going into the hospital systems for care. If we look at this, and the modeling also suggests that we could get through this event if we can keep our infection rate down to 20%. If our social mitigation strategies, such as staying home, staying put, do not hold and our infection rates increase, then we will have an increased stress on our capacity in our healthcare systems. So when we look at what we can do, first of all, we are bringing in as many supplies as we can. We are conserving the supplies we have right now, But we also need to reduce the number of individuals who may be exposed and become ill. And I know that we've passed out an infographic that has our modeling out there so that you can take a look at it. So what can we do? Every single one of us know that your health department, your healthcare systems and partners, our emergency operations center are doing those three things to bring in the resources that we need to care for individuals, redesign and reform our care that we can, conserve the resources we do have, but we also need our community to do its part, which is to really stay put and avoid the transmission of the infection. By reducing the number, we can model through this, and our healthcare systems are prepared to respond. The numbers we provided you today are for if we were just Winnebago County and we could put a wall up around Winnebago County, so I want to be clear about that. They do not reflect what it is to be a regional healthcare partner system. And we are a region leader, so we need to understand that as our numbers change around in our region, that we will also be modeling that as well. But we wanted to give a picture to our community today of what that would look like. So I want to thank everyone for getting that information out. I know there's a team up behind that's looking at data every day. How are others modeling it throughout the state, the region, and the nation? We're looking at data coming out of other states who have a little ahead of the curve and where we're at in terms of the curve. But we can all do our part, as we've said before, to flatten that curve. But please know that we are preparing to respond to the next phase, which is to care for those individuals who are critically ill and need hospitalized care. So thank you. I'm next going to turn it over to Mayor McNamara for his remarks.
Thank you, Dr. Martell, and just thanks for your continued tireless leadership through this. I hope everyone who's watching this is watching this from the comfort of their own home. It certainly is absolutely critical, and I think bears repeating. Please stay home at this time. As the chairman and as Dr. Martell have already previously mentioned, you can spread this tremendous disease long before you're even feeling the symptoms. So please stay home, be part of the solution. Just also want to say my thoughts are certainly with those families and those individuals in Winnebago County who are fighting this disease, and know that all of our community is thinking about you and praying for you and your swift recovery and the support of your family. We know right now that cases are growing rapidly in the state of Illinois and across the country. In Winnebago County, quite honestly, we've been fortunate that number of cases are growing a bit slower here. We're behind the rest of the state and the country. However, we are using this time to prepare. Listening to health experts, we know that this is not a sprint, it's more of a marathon. Therefore, we must continue to be vigilant. We must stay home, we must continue to practice the social distancing, and we must continue to wash our hands and frequently use surfaces often. When I, Chairman Haney, and Dr. Martell employ you to remain vigilant and follow critical guidelines, there's many reasons we do so. One, we do it for yourself. We want you to be healthy. Two, we do it for your family. We want all of you to be healthy. Three, your children, your parents. We also do it, though, for the clerk at the grocery store. And we do it for our first responders and our healthcare workers. We need all of us to practice these safe practices so that we can keep everyone healthy. So since this pandemic began, we've tried to give you as candid of a view as possible. To those listening and watching, I hope you agree with us that we've treated you as adults, as responsible citizens and part of this solution. We've been briefing you regularly and sharing information with the media as well as on social media. However, with all this information that's come out, I've come to realize that we've explained why social distancing and staying at home is critical in two facets, but maybe not so much the third facet. So first, and I hope it's obvious, we don't want you to get sick. So that's one reason why social distancing and staying at home is important. Two, we don't want you to infect others. That's another reason. But third, and maybe not as obvious, is in any community across the country, we only have so many healthcare professionals. And in fighting this pandemic, there's only so much personal protective equipment to go around. And thirdly, there's only so many hospital beds in a community. So you've heard Dr. Martell explain earlier, you've heard her explain that earlier, and so we know personally we can't stop COVID-19, but what we can do is slow the spread of COVID-19 so that there's not a surge of patients who will all need the hospital care all at the same time. All these decisions and guidelines and restrictions are for your health, your neighbor's health, and the protection of our health systems. When all of us work together, we can beat this and slow the spread of COVID-19. When we don't, and if we insist on leaving our houses when it's not necessary, we will infect others. That's just a mathematical certainty. At the same time, we know that proper planning prevents poor performance. We're diligently preparing for the worst while hoping for the best. Across our community, we're seeing examples of people working together in ways that they may not have been doing beforehand. The city, Winnebago County Health Department are all working together. We're in constant contact with our healthcare organizations that are putting aside their competition and working together to prepare for a surge. They're gathering supplies and materials and equipment. They're setting up tents and other extra facilities. They're postponing elective procedures to free up hospital space for that surge. It's a right strategy at the right time for our community. Rock Valley College is housing our healthcare supplies to make sure we have enough available when they're needed. The University of Illinois College of Medicine here in Rockford will be fast-tracking graduation of their final year medical students so that these now doctors can help respond to COVID-19. Social service agencies and nonprofits are also sharing resources. Many in our community are alternating their business models to help us fight the spread of COVID-19. The Rock River Valley Blood Center is working diligently to meet the ongoing and pressing needs of our hospitals. And so I would make a quick plug and say, if you are able, please call and schedule an appointment and then go in to donate blood so you can help save further lives. We're working here locally. We're working with our bipartisan state and federal delegations so that as you hear of these stimulus packages, we're working tirelessly so that Rockford and Winnebago County is front of mind so that we get our fair share of those dollars and that relief. Yesterday, we announced, as the chairman mentioned, a $2 million COVID-19 Small Business Emergency Relief Fund with the Rockford Local Development Corporation. We did this so that we can provide lower interest loans between $5,000 and $50,000 to small businesses right here in our area to help them get through that difficult time until the federal stimulus dollars reach Main Street. The City of Rockford's Human Services Department and the Community Foundation of Northern Illinois have also partnered for many years to administer a family crisis fund. This fund will provide essential support for families who have the greatest need and who have been impacted the most by COVID-19. And today, I'm proud to announce another example of our community coming together. Just last week, United Way of Rock River Valley launched an Emerging Needs Fund to provide assistance to nonprofits so that they can help Winnebago and Ogle County residents impacted by COVID-19. Today, the Shellstrom Foundation has pledged $125,000 to that fund. The foundation will match each dollar donated by the public up to $125,000. This fund is already nearing $50,000 in donations. Meyer Grocery Store donated $26,000. An anonymous donator donated an additional $10,000. But they are welcoming any donation. If it's $2 or $2,000, they're welcoming those donations. So think about that just for a moment. In less than 2 weeks, our local United Way came together. They saw a need, and we are seeing foundations and businesses and individuals step up and say, how can they help in this great time of need? We must keep growing this fund. So I'd implore you, if you are able, please consider donating, and you can donate as an individual by texting TOGETHER to 40403. That's texting TOGETHER to 40403. You can also donate online at unitedwayrrv.org, and you can also mail them checks. And if you're a company and you've been inspired by the phenomenal and gracious donation of the Shellstrom Foundation, you can directly call United Way at 815-968-5400. 100% of the donations will assist families and children in providing basic needs during this health crisis. We're all looking for ways to help, and to me, this is the best way that we can help right now those families and children in need. And again, whether it's $1, $10, $100, or $1,000, those donations will make a great impact in a family's lives right here in our area. So this is, as I've said each time, a difficult time. It's a difficult time for every single person who calls Rockford home, and this is a marathon and not a sprint. We know we will have some setbacks along the way. We know we may get drawn off course by different obstacles that pop up. However, we all must remain vigilant. We must be consistent in our actions to protect our families, our friends, our neighbors, to help slow the spread of the virus. We're all in this together, and every person has a role. Again, I'd ask that you stay safe, stay at home. Thank you.
Any questions?
Dr. Martel, thank you for giving us these capacity numbers. Can you talk about what assumptions you made to arrive at these figures for bed capacity?
Sure. We used the Harvard model that was, we can provide you with the links as well. But again, there's two things. You say the two assumptions at the bottom of the page. There's the 20% and if 60%. So there are two different modeling that we do. One is if we can reduce the level of infection in the community to 20%, what will bed capacity be? And it's based on our population needs and looking at certain segments of the population over 65, those that will need ICU care. So that's where those assumptions come from. Now remember, and I caution everyone that typically this formula is used on what they call a Rockford Regional Health System Referral Network. So it typically includes other communities. But we really wanted to start today was looking at our local picture, but recognize that all three health systems are feeder systems for other community areas as well. So that's the next phase is really begin that kind of broader, moving out. We really wanted to get a snapshot in time here.
Are you able to tell us how many, if any, of the 8 patients are in the hospital or in ICU bed?
No, we cannot release that information at this time.
Can you say if any of them are fully recovered?
At this point, we cannot release that information.
Okay.
So when you find a positive case, can you walk us through what you guys do? Do you backtrack to see who they talk to? How do you kind of narrow down where it came from? And do you test everyone that they came in contact with also?
So that's a great question, because I think that kind of also helps with the messaging that goes on social media about, I hear about this, I hear about that. So when we get a case, so someone who has a positive lab test, the first thing we do is work with the physician who ordered the test. So we've gone back, a physician must order the test. We work then to notice the patient, also the healthcare team that may be working with them, if it was brought in by a first responder group, that group that was an intimate contact detail, that become a contact that we want to make sure we first begin that investigation piece. We then work with the individual, who is the case, to find out where they've been, what contacts they had, where they work, where they shop, who else they might have been with. Household contacts are typically at greatest risk. Not every household contact is tested, and we've kind of talked about this a little bit before. Sometimes they're indicated as a probable case and told to remain in isolation.
And so it's like just in case if somebody you live with has it, you might not get tested because the chances of you getting it are pretty high.
Household
you don't want to kind of waste that test.
Well, and again, the correction is, you're right, they might not have to bring them into a healthcare system, right, for valuable resources. So oftentimes what's going on right now, the household is considered the highest risk contact for that individual. That's a case. And so we've talked about why we don't release a lot of information out, because oftentimes not only do we find out who the household contacts are, but it might be their employment, where they went to school, what they did all day, any church contacts, all of them become noticed. And it's oftentimes an outreach to let them know that they may have been exposed in the directions that they need to follow.
And so one thing I know we've been getting a lot of calls with is people that do have symptoms, they're told to stay home regardless if they have it or not, and go to the hospital if they get severe. What's that threshold that they shouldn't stay home and seek hospital care?
And again, the physicians and clinicians are very much working. They're doing that assessment. Many of them are doing it electronically, so they do some tests to determine whether or not, I'm going to say breathing tests to see. They'll count respiratory rate to see if the person's respiratory rate is increasing, if their fever is increasing. They're often told to monitor that. And again, they'll make the determination of whether or not they need to bring them into a hospital setting for care. But it's very much a planned care system at that point, right? Because we want to bring them in so they minimize exposure to others in the waiting area, other healthcare providers. And if it's an emergency, we do use a notification system through the CAD so that if that address comes up, the first responders are very much aware to go in full PPE to transport that patient to a hospital.
And so I know for me last weekend, it wasn't hard for me to stay home just because the weather was so nasty. But with the weather getting a little better, and we've been in the 50s all week, do you see yourself doing kind of something similar to what Chicago did to shut down public areas to keep people from that temptation of going outside in nice weather? Well,
first of all, our executive order had many of those already closed. What we would say is, again, this becomes part of that social distancing. We do encourage people to get out a little bit, get some fresh air, but again, maintain that 6 feet of social distancing. If we see that people are not able to maintain that and they're violating that, then we often have to step in with some additional guidance for that. We were saying, last night I was out in my neighborhood, people are walking their dog, we wave across the street, right? Stay and put, right? With the message that we all want to stay safe. We understand this will become increasingly difficult for individuals. But the other part that we kind of talk about is go out for the essential things that you need. Go out if you need groceries. Go out if you need medicine. Go out if you need medical care and you've been advised to do so. What we don't want are people going into stores to browse, right? This is not the time to go into a store and spend the afternoon browsing. Why? Because, again, you increase the risk of exposure. Limit your trips to one trip. Try and use curbside pickup for groceries and medicines, the drive-thrus. So again, that you're protecting the individuals who are the essential service workers in those environments so that they can also stay healthy to be able to provide those essential services to us. So oftentimes I hear about, well, I'm going to take a ride out, I'm going to go to the store I'm going to do all my grocery store, I'm going to take my whole family on Sunday. That is not an appropriate activity. We want to really limit that outside, kind of minimize that contact exposure to others. Designate one person in the family to go and run that errand to the grocery store. Minimize the amount of time they're spending, I said browsing, which is very hard because I think that is, as we know, kind of a tradition in our country is to take a look at things. But how can we do a better job at that? Because if we can get that number and keep that number at only 20% of our population getting ill, then we can get through this with the resources we have available.
Dr. Martel, I want to go back to these capacity numbers.
Sure.
These are the resources we'll need, hospital beds we'll need. First of all, is this total hospital beds? How many of the 1844 are ICU beds, for example? Do you have that breakdown?
We can break that down for you.
And these are resources we'll need in 6 months. If we have a doubling, you're telling us, every 6 to 7 days, gosh, where are we going to be? I don't know how far we are behind New York City. Where are we going to be in 3 months or 1 month?
Well, that's why you see the 6-month projection, right? So the other part is when you look at the total beds, remember every single one of these beds, our hospitals are working to convert, if need be, to an ICU bed. So capable of providing intensive care unit type services. So again, you'll see the modeling at the top. These are the resources that we have as of today. And those numbers you'll see start to change. Remember, we talked a little bit about that. As we begin to, patients get out, they start to convert those beds to potential ICU beds. We then will also be looking, as we talked about a little bit, about alternate care for those that are less critically ill but need some type of form of care.
Can you talk about this issue of screening? We have a lot of large employers in our community. The county has some large facilities where a large number of employees work, River Bluff Jail.
Mhm.
Should large employers be screening their employees as they come into work? What guidance would you offer?
The guidance has been out there for congregate settings. So as you notice, we also, as healthcare workers, we have our temperature taken as we come in and we're monitored for signs and symptoms. And at any point, if we become ill or report off, we are masked and moved out of the workforce, as are the other centers where they have congregate living. So things like the nursing homes, long-term care facilities, some of our congregate living situations, drug treatment centers, things like that are all following those guidelines. If you're talking about screening in terms of testing, we've talked about this kind of, and it's been talked at the national level, which is the test for COVID-19 is really designed to test positive individuals.
I'm talking about my temperature was taken when I walked into this building. Are your employees taking their temperatures before they walk?
Oh, yes.
Into work? What about River Bluff employees? What about the jail?
Yes. They've been given that same guidance, and if you notice, we have markings on, we call it the runway or the ramp. We come in, we're screened at the start of our day and midday.
And so that's what you'd advise, like, large employers to do, to take temperatures before they walk into
Well, again,
Collins or Woodward or such places?
those are not congregate living situations. So again, we're talking about, there are two different kinds of recommendations and guidance. We encourage that social distancing, right? We say whatever you can get that 6 feet of social distancing. Many of our manufacturers have put in some of those guidelines already, which is prompt isolation if anyone should become sick while in the work, making sure that they have, guidelines for how to isolate an individual, staggering shifts, lunch hours. Normally you might have a group that you eat lunch with. You cannot do that. It's really kind of a whole disruption with the idea of how can you safely maintain essential services while still creating that social distancing. And many of them have policies in place about monitoring or screening, and those are different in terms than a healthcare worker or a congregate living situation.
So I have a question. I'm not sure who could answer this, but we've also been getting a lot of calls about people not thinking their job is essential, but they're still going into work. Is there something or someone they can call for that problem to maybe report a boss or get clarification on why they're still having to come in?
We have been dealing with this since the executive order went in. And again, there's, I'm going to say we have COVID-19 at WCHD.org. Again, COVID-19 at WCHD.org. Every complaint that comes in, we work through with both our legal policy team, which includes our Winnebago County State's Attorney and our City of Rockford Council, as well as our code enforcement officers, to decide, to look at the intent of the executive order, determine whether or not they can meet the criteria, and work as an educational process, just like we do for routine code enforcement. With the idea being that, we really need to understand maybe how that business works, how it's defined as an essential, and then if it's not appropriate, then they're noticed and they may be ordered to close.
Is there any legal ramifications they might face for staying open?
We're going through that process right now, and we use all the tools that we have available to us from the code enforcement process.
And I have another numbers question. So, so if there's 8 in Winnebago County, does that mean all 8 people are being isolated here, or all 8 tests were taken here and they could live in another county?
No, those are residents who, it's based on their community of residents, and so they would be isolated here.
So if like someone tested positive in McHenry County but lives here, that would be in the Winnebago County staff?
Correct.
Keeping on the numbers theme, we've heard Governor Brisker talk about asking retired nurses or people who have recently left the field. Has Winnebago County or the surrounding areas seen any number of retired nurses come back into the practice?
That's being handled on a statewide process because they come back in to be re-credentialed and their licensure process. We have, obviously reached out in our own community areas. I'm sure as a professional, I get people on the backside of Facebook and I'm referring them so that they can get credentialed and come back in. That's what our Emergency Operations Center and the group that's working on how they're going to staff facilities and what's going to be required are working to bring all that in. And you heard earlier about the University of Illinois College of Medicine is working to graduate individuals. We also have done some surge capacity with both the medical students who have been working with us on the quarantine and isolation monitoring. So we are bringing everybody in that we can. from a local medical reserve corps, which we also have in Winnebago County. Those individuals have been, we call it stood up, but basically we bring them in to assign them opportunities, activities to work with us in areas for surge currently.
To clarify some numbers, you say the Rockford area region with 16 total cases. I believe Illinois Department of Health kind of has our area around 15, 8 in Winnebago County, 2 in Stevenson, 3 in DeKalb, 1 in Joe Davies, and 1 in Whiteside. That comes to 15. Are we missing something there, or just want to make sure we're clarified on that?
I can go over those numbers with you.
Okay. And then just one last thing. I'm not sure if you said it.
So we're clear, 8 confirmed cases. To date, we've had 202 negative cases. We have 305 pending cases, which is 59% of all the tests that have been run as of today. Now, every day we report those numbers at 8 o'clock in the morning. Positives come throughout the day as the results are dropped to us. But we really are reliant, as we talked before, on our hospital partners and all of our healthcare systems who voluntarily provide us with the logs of individuals they've tested through private lab.
Is that the discrepancy in state numbers and our numbers, and so the private lab isn't counted in the state numbers?
And we've talked about this before. They now are referring you back to your local health department and region for confirmation of numbers, because there is a lag, because they report their numbers at noon. We may be getting additional numbers that we may not have gotten into systems yet, or because we've talked about, we get the positives reported through both the private lab sector, as well as a system called INEDS that comes through the Illinois Department of Public Health Lab. And sometimes it's just that lag time. But typically they confirm their numbers as of noon. Our total numbers for testing are confirmed by 8 a.m., but our total positives we report out through the day.
Dr. Montellis, it's not really known how many people might be asymptomatic. Is there any desire to pursue these antibody tests that I'm reading about, a true snapshot of a population?
There are many individuals working toward this because, you know, if you read the literature, right, 12 to 18 months for a vaccine is what they've been projecting. An antibody test would let us know if you've been exposed and to build antibodies toward it. Right now, the only test we have to tell us if you're actively sick or infected with COVID-19. And even if you test negative today and are exposed 2 days from now, then that test result becomes invalid and you may still be incubating for up to 2 weeks. So if you were exposed today, and I tested you today, and you come back negative, we'd have to retest you in 2 weeks after your exposure to make sure that you were in an incubation period. So that's the issue that we have with testing, and we've kind of talked about this before. It's important when we've got hospitalized patients in congregate settings to make sure that we know what we're looking at, that it's not an outbreak of another influenza-like illness in a skilled facility or congregate living. And that's why oftentimes with mild illness, people are instructed to stay home so we can really conserve the testing and decrease the turnaround time so that we can truly get those cases where we think they may be in congregate living situations.
That's why I asked about the antibody test. You need to tell
We would,
us are immune and then just go back to our normal lives.
it would be great. And I know that they're, I believe everyone, the NIH, the CDC, everyone is pushing for that.
And just to confirm, it's 202 negative and 305 pending.
Correct.
Tom, Frank, can you talk about specific asks you've made for economic relief? What kinds of economic relief is Rockford the most from our congressional delegation?
So specifics, what we've been talking to them about is getting money into Main Street businesses, making sure that one big thing that we're asking right now, I mean, we just are looking at this bill and it's not signed, so it's not even official yet. So we had a conversation today with our state lobbyist and have had conversations with the federal government. Our biggest request right at this point is trying to get the dollars here locally to use, as opposed to having either the federal government run a program or the state government run a program. We have, I think, a proven ability to put those dollars on the street faster than either the state or the federal government. So as the stimulus language becomes more clear and is finalized, our biggest ask, since it's not clear nor finalized right now, is as they're working on this, allow us here locally to develop the programs and initiatives to get those dollars on the street quick. That could be a perfect scenario. But the big thing that we're trying to avoid, Isaac, right now is not necessarily very specific asks, because we have a host of needs and the bill's not developed. What we're looking at is more, we need authority. When the bill is developed, we need authority to deliver those resources ourselves at the local level. I think you could look at just yesterday with the NICDC. They have the capabilities, we have the know-how here, and many of us, they're not small businesses, as I've said a number of times. These are folks that we know. We know them by first name, we know what they have going on, and we know their needs. Let us here locally determine where the greatest need is and how we can get those dollars on the street. But specific asks, no, because the bill isn't totally finalized to have those specific questions to address it.
The question was around asks right now. I have two that pop out. And number one is to our county board, that they have been very positive, enthusiastic about the yesterday's announcement around the emergency small business program with the RLDC, with the city of Rockford and a number of area banks. We are being asked to partner at a $250,000 level out of our host fee fund. There's a lot of enthusiasm around that, but my ask is that we move that through our board very quickly. It is subject board approval. I would just say this, I'd echo what the mayor said. A little bit more specific on this is when money does go from the feds to the state, the idea that we get our fair share. We are in a state where we have a powerhouse city within our state in the city of Chicago, and the idea that Winnebago County, the Rockford region, city of Rockford are priorities in the discussion at the state level. I think that is true, but that's something we got to continue to beat the drum with, along with our state delegation. So we will need our Democrat and Republican members of our state delegation to play a leadership role at that time. Any other questions? Good. Thank you very much, everybody.
You're just watching the end there of the Winnebago County update on the coronavirus situation here. Dr. Sandra Martell from the Health Department says there are no new cases in Winnebago County. Positive cases stand at 8, but close to 60% of the tests submitted are still waiting for results.
She stressed the importance of staying home. You can spread the disease even if you don't have symptoms. We'll have much more on what Rockford hospitals are doing to prepare for more cases. That's coming up on Eyewitness News at 5. We hope you'll join us then.